here.
All right, Rick, thank you very much, my friend. Rick Leventhal in London. Well, all 8 UK terrorist suspects were either doctors or worked in the healthcare profession. Is it because Britain's national healthcare system pays physicians such a low salary that they actually have a shortage of doctors, forcing the country then to recruit from foreign countries? Let's ask Jerry Bowyer, Jerry, columnist for the National Review Online. Jerry, you think that could be the problem?
I think that's certainly a contributing factor, Neil. I mean, I looked at the statistics for foreign-born physicians in countries that have state-run healthcare enterprises like the United Kingdom compared to private enterprise like us. And what you find is far higher rates of importing physicians, and not just physicians, nurses from abroad. The United Kingdom is the largest importer of medical personnel in the world, feeding them into this huge bureaucratic system, and that's going to create a certain amount of vulnerability.
You know, the argument that the country has used for just the sheer increase in Muslim doctors is the sheer increase in the Muslim population. And in, for example, Birmingham, England, where a lot of these guys came from and where one of the attacks was first hatched, it's up to 30% of the population. Maybe that's the problem.
Well, yeah, I think that could certainly be a problem. But, I mean, I think the biggest problem is the first thing you pointed out. Look, physicians in the United Kingdom are civil servants. You don't have the same level of prestige. You don't have the same level of economic achievement in that case. So guys who, maybe they would become doctors, instead they become scientists or something else, that creates a shortage of physicians. And then on the other side, Neil, you have a kind of a supply push, because the Muslim world is very good at creating physicians. It's a very prestigious profession. It's something even Muhammad wrote about in the Hadith. Islam holds physicians in very great esteem. And in closed societies like Saudi Arabia or Jordan, where you don't have much else to do because you don't have much of a business or entrepreneurial sector, you're producing a lot of doctors. So they're producing more doctors than they need, and National Health Services is having trouble recruiting doctors. So you have demand pull and you have supply push, and that's why the National Health Service imports more medical personnel than any organization in the world.
That's fascinating, Jerry, because if you're right now, let's assume Britain tightens up the standard, saying, hey, look, we've got a lot of questionable Muslim doctors in our ranks here. We're going to at least slow down on the visas allowing them in here. They will then go elsewhere. Where else likely do they go?
Well, you've got shortages in doctors and nurses basically wherever you have state-run health care. The United States, we import a lot of physicians, about a quarter, but in the UK they import about half, nearly half of their physicians and nurses from abroad. So they're going to go to other state-run enterprises. They're going to go to other places in Europe. This is a real vulnerability. And, Neil, it's not just a matter of them supplying, the Muslim world supplying physicians and Europe needing them. I think you also have a situation where a state-run healthcare enterprise is bureaucratic. And I think the terrorists have shown over and over again, whether it's dealing with INS or whether it's dealing with airport security, they're very good at gaming the system with bureaucracies. They're very good at figuring out how to get around bureaucracies.
Well, you also have the advantage in a bureaucracy, Jared, I think you pointed this out, of becoming invisible, right? Whereas if you were to join a U.S. medical practice, or even as some internists do, just join an operation, let's say, in Missouri or Kansas,
right,
you would stand out for your religious views, or being an oddity, period. There's not a racial comment, but it just is. So,
yeah.
So that's what is distinctive about, in a national system, it's more diluted, right?
Yeah, yeah. Think about your doctor. I'll think about my doctor. Doctors in America tend to, sort of cluster together in these practices with 3 or 5 or 6 or 7, maybe a dozen partners. It's a partnership. Legally, it's organized as a partnership. Yes, they serve in a hospital, but that's not their main source of income. And if one of your guys is a jihadist, if one of your doctors is spending all time reading, online reading Osama bin Laden fatwas, somebody's going to notice that. But the National Health Service is more like the post office. There's a lot of anonymity. It's easy to hide in the bureaucracy. And more to the point, if you're a physician and you're in partnership with another physician and they turn out to be a terrorist, the practice is blown. I mean, there's severe economic consequences for you. But in a big bureaucracy, that's not the case.
So the fact that we might be looking to go this way in the United States, you're saying one of the potential consequences, without judging national health care one way or the other,
right,
is that this could happen, that we have to be at least aware of the distinct possibility in such a system.
Yes.
We would have to recruit outside doctors, And where we're getting the most of them these days seems to be from the Muslim world.
Yeah, if we go with a British-style or German-style healthcare system, we're going to have British-style or German-style recruitment problems. And we're going to turn to the Arab and Muslim world for doctors because they're producing a lot of them. Wow. And if we organize ourselves that way, Neil, we're going to have bureaucracies which are going to find it hard to shield themselves against infiltration from terrorists.
Jerry, you make people think. Thank you very much, Jerry.